How can heart failure affect a patient's life in limiting what they're doing?
Well, sometimes it just limits their ability to get around. Even if they're short of breath, they don't want to go shopping. They may not want to spend time with their family because they can't get up and can't walk. So they'll limit the activities that they do. If they become to where they have swelling, they may not be able to walk as well even, and have limits that way as also. Heart failure can increase blood pressure, it can decrease their capabilities, it can make them feel just sick and not good.
So how can a clinic like yours help to improve their life, their quality of life?
Well, what we do in our clinic is we look at the whole person, what's going on, what are the medications that they're currently taking, is there any way that we can adjust those to help them with their symptoms of shortness of breath, high blood pressure, etc. We look at what types of things that they're eating, look at their diet, is there some way that we can help them and educate them on the type of things that they're eating and decrease their salt intake to help with the fluid balance. We also look at just in general, what's their exercise, what do they do daily? We're not saying people have to run a marathon every day, but if they're pretty sedentary, maybe it's just walking a block every day and trying to come up with an exercise plan that fits them and fits their lifestyle. Just any type of increases and any type of changes like that in what they do daily can help them and help prevent their symptoms and keep those under control and managed.
What role can cardiac rehab play for a heart failure patient?
Well, we're very fortunate because CMS has, over the past couple of years, have allowed payments for heart failure patients in cardiac rehab programs. And what we see is that's a program where they come usually 3 times a week for maybe up to 12 weeks. And there's specialized nurses and exercise physiologists that work with them to take where they're at today physically, and that may be very conditioned, and maybe they've never exercised before, and to help to build their exercise tolerance, and to do it gradually and to do it safely. It's under a monitored setting so they can watch their heart rates, they can watch their blood pressures, and then they can collaborate with the physicians and the advanced practice nurses to help manage those medications to keep their blood pressures under good control. And what we find is that it improves not only their quality of life, and when we do quality of life studies, but it also kind of gives them, when you talk to patients who are experiencing cardiac rehab and are going through that, it just gives them a real sense of increased well-being. And they talk about how they're able to do the normal activities that they wanted to do at home. Maybe it's just doing some housework or some laundry, or it's going out and doing some shopping or things that they normally didn't feel like doing. So it really increases their well-being as well as their exercise tolerance. If you look at the research, then it shows it also improves their longevity. So it decreases mortality, and it decreases the chance of having future heart events as well. So.